one thing that I always notice when I'm doing these podcast conversations is there's always something that I feel like leads someone into their exploration of what they end up sort of going very deep into with their work, especially in health fields. So my guess is that there's some problem early on that you needed solving that you couldn't have solved.
Oh yeah. It's interesting. When I was younger, I played a lot of sports.
Yeah. What was your sport?
Well, my primary sport was football.
Okay.
And my goal when I was a kid was to play professional football as a linebacker.
Yeah.
And, I suffered concussions, shoulder problems, all sorts of different things. But I did manage to go to college. I'm from Canada originally.
Yeah.
And I went to the University of Western Ontario. And, it's interesting, back in your early 20s, you think your body's invincible.
Oh, yeah.
And so I would get one injury and another injury, and I just kept playing. And eventually my coach saw me, and he saw that something was up, because you kind of hid your injuries from the coach.
Yeah.
Because if they knew your injury, they just replace you with someone else.
Yeah.
And that's sort of, what I was facing. But as interesting as it was, that's what led me to get treated. I went to an athletic training clinic right there at the university. And the treatment of choice was they would submerge me into ice cold whirlpool tanks. And you had to stay in there for about 8 to 10 minutes. And they'd pull your lifeless body out. And then they would do electrical stimulation. They do massage. They may do some stretching. Now, these treatments, they were beneficial if you had an acute problem. And, my pains eventually went away. But what I found is that every time I went, into the field and I tried to run or change directions, I kept getting all these same complaints. It was my right knee, which was my original injury, but then that festered into my right groin, my lower back. I had sciatica, and I had all these problems. And I clearly remember, and that's probably a driving force for me to learn, was that the therapist back in that day, and they still today, it's still a pet peeve of mine, is they focus on they focus on the site of your pain.
Yeah.
Your knee in that case. And they just do things to it. They'll ultrasound that, they'll electrical stim it, they'll ice it. And they didn't sit back and look at, hey, this guy's had concussions before. This guy's injured his shoulder. This guy's done this. They didn't look at the whole body.
Yeah. Or they didn't get your story, right? I mean, they didn't get your whole story.
No, they didn't sit back and do that. And so that's always been in the back of my mind. But, they always say when they close one door, maybe a window opens somewhere else for you to go. But that led me to become an athletic trainer.
Yeah.
And the problem was I would do the same things that they did to me on my patients. That's all I knew.
Right.
So everybody got ice cold whirlpool tanks. They got ultrasound. They got an e-stim, all those things. And I realized that wasn't enough.
Yeah.
And that led me to go to physical therapy school. And I went to University of Toronto.
Okay.
And I'm really glad I got in there, because he's still a good friend of mine today. His name was Doug Freer, and he was my teacher. And I eventually went to work for him. What I loved about him, phenomenal teacher, is that he was a clinician as well as a teacher. He ran 2 physical therapy clinics. He would be treating patients and would show up for class, and he would give us real life situations.
Yeah.
But he's the one that put it in my mind about osteopathy, about craniosacral, myofascial, visceral, strain, counter strain, muscle energy, all these different techniques. And I remember him say that these techniques, they get to the core of the problem.
Right.
They get to the root cause. And I started to think of that. I go, all I was getting was hot, ice cold whirlpool tanks, hot packs, ultrasound, electrical stim. I wasn't getting any of these things.
Yeah.
And so my first year of physical therapy school, I took a class with Dr. Larry Jones. You might know him. He's created strain, counter strain.
Yeah.
And as a student, you get a discount. So I took his class, and I remember being on that class. I went with a friend of mine, and we were palpating. It was the lower quadrant. And right where I had that old knee injury, there was a severe tender point, patellar tendon. And my friend hyperextended my knee, externally rotated. He found a position that it was no longer tender. And we held it there for the 90 seconds. That's what strain counter strain is about. And then they take you out of the position slowly. And all of a sudden I'm walking around, I go, oh my God, this knee is so much better. And I go, come on, do some more points. And he found a point in my groin, and that felt like someone was sticking a knife inside me.
Yeah.
And I remember he folded me over, and there was no tenderness there. And a lot of times heat comes off your body and things like that. And after the 90 seconds, we came out of the position and we palpated it. And I go, you're not in the same position. And, he palpated around, there was nothing tender. And my back was feeling better. And it was amazing. I mean, that's what really got me going. And I'll tell you a funny story is that when I came home from that experience, I was still in my first year of physical therapy school. We had our school in Toronto was 4 stories high, and the top story had all these treatment tables. We call them plinths. And I knew the custodian, the janitor, and I gave him a case of beer if he would unlock the door for me at night. And I actually started my first clinic, an illegal clinic on the top floor. And it was a very thriving clinic. Is that I would bring in, they were all athletes. I would come in, sprain, strain injuries. And I used it as my laboratory to work on these techniques. Yeah. And my only technique at that time was strain counter strain.
Huh.
And that's sort of where I started. And it was simple. You find a tender spot, position of comfort, hold it for 90 seconds. And then and then it would release. And it was amazing. And it worked so well. Yeah. But what was interesting is, I really remember that is even though you're successful 70% of the time, I can remember those patients coming in where I couldn't find any tender points. Yeah. Or I treated them, a week ago and they came back and the problem was still there. So I think what drives all of us is not so much our successes, but our failures. Yeah. Is it pushes us in a certain direction. And so I realized that strain counter strain, can only take you so far. Right. So that got me taking courses. Right. One course after the other. I just.
And you are the master of taking courses.
Oh my God. I probably hundreds of classes.
Yeah. But I understand. We are looking for sort of a toolbox of things, and at the same time, I do think it's important sometimes to just exhaust everything you can within a modality and try and see what you can do. And even when I treat, sometimes I do that. I'll kind of take things to a specific point where it's okay, so that seems like as far as I can go from there, and now I want to try something else. Mm-hmm. But just knowing that I have those in my back pocket is also helpful.
And that was beneficial for me because I did exactly what you said, is that each time I learned a new modality, I would go upstairs to my, illegal clinic.
Your lab.
Yeah. And, I went from strain counter strain to muscle energy, which is the opposite, which is working on joints. And people go, well, how come you're not doing those tender points? I go, that crap doesn't work. We're working on joints now, right? And each time you think you have the answer. You think you have the holy grail, you have the answer to solve these problems.
Yeah.
And when you're excited about it, the patient's excited about it, you do the changes and you do get results. But then there's that learning experience. Somebody comes in and they don't respond well, to what you're doing. And that kind of moves along. And I remember taking myofascial release. That was from John Barnes. And I remember he says, this is the missing piece of the puzzle. Mm-hmm. And he goes, if you failed at, he said strain counter strain muscle energy, it's because of the scar tissue, 3-dimension, the ground substance. And I go, finally, I've got the missing piece of the puzzle. So you start to go back and you're all excited, but again, it wasn't, and, you realize that taking all these courses, that all these therapies were important. We've talked before about everything that you've done. Everyone, any clinician that's listening to it, all therapies work.
Right.
There's going to be somebody out there that's going to, like a key fitting into a lock. They're going to be perfect. And the teacher of that gets so excited because they did that. But we all have our failures.
Yeah.
And it's those failures, it's those people that aren't responding to it. That's where we got to keep looking for, new ways of looking at the body, new ways of evaluating.
Yeah. And I find the same thing. And I think there's something about kind of hitting an endpoint with somebody. It's humbling for one thing, but we'll get into that. I want to get into how you evaluate these things, because I think that's really the most important thing. But a lot of times we start out with that evaluation. We find we find something that we think is important to address, and we'll talk about all the different things that it could potentially be. But then sort of, going with what our experience is and things that we've seen as patterns, and it's the anomalies really when we have to sort of go deep into the toolbox. So how is it that I know you've started a school. How long has this been operating now?
The DAmbrogio Institute, I think, has been around the past probably 6-7 years.
Okay.
Yeah.
What led you to starting it?
Well, I started, like I said, taking all these classes, and eventually I started to be an assistant.
Yeah.
And eventually they got me teaching. So I just started to teach these classes. But I remember just accumulating a lot of information. And I realized I was in my clinic one day and a patient came in with low back pain and I didn't know what to do. I had too many options, too many choices. And I think a lot of your listeners will fall in that same category, is that, you just have so many options. Do I work on muscles, joint, fascia, fluid, energy, emotions, whatever. And so at that point, I realized that all I had was a bunch of techniques. I had to learn evaluation. So I actually went back to osteopathic school and started to realize that osteopathy is a philosophy. It's based on principles, based on evaluation. And so I started to, put that together. And it was John Matthews, John Upledger's son from the Upledger Institute. We were friends, since 1988. And because I took so many courses at Upledger. I mean, I studied with Jean-Pierre Barral when he came in the early 90s. Right? Yeah, oh yeah. I studied all the great people. I was so lucky, you're the strain counter strain, Larry Jones, but muscle energy, Fritz Smith, cranial sacral, the myofascial people, all the originators of the technique. I was really fortunate to study with them. But because John and I stayed friends, he knew my my journey, taking all these classes, being a physical therapist, athletic trainer, acupuncturist, and now osteopath. And he thought that what he had already, Upledger dealing with cranial sacral, and Jean-Pierre at the beginning was dealing with visceral work. He does other things now as well. But he said, wouldn't it be nice to have an osteopathic curriculum and part of the International Alliance? So he brought me in to kind of fill in the spaces, bring in other muscle classes, joint classes, fascial classes, fluid classes like lymph and energy and evaluation.
Yeah.
And the key thing I wanted to bring to that, because of myself being a student, is I just didn't want to have a class that's teaching more techniques. I wanted to have a class that empowers the practitioner to be able to evaluate and answer a few questions.
Yeah.
Where do I treat? Okay? Because most people think you treat the site of, pain.
Right.
But where's the underlying cause?
Yeah.
And once you find out where you're going to treat, what are you going to treat?
Yeah.
We have lots of options, muscles, fascias, joint, fluids, energy, emotions, all these different things. And I came up with that because those are questions I had as a student. And I kind of felt that other people have those questions. I'm not alone.
Yeah.
And we all tend to, when you take a class, you tend to use that information on your patients for the next few weeks, and that's how you kind of determine things. And I realized by meeting, thousands of practitioners, that everybody has their favorite form of therapy. They'll even say, I'm a cranial therapist, or I'm a visceral therapist, I'm this or that. And I think that's a disservice to the patient. I think you have to be the therapist that they need, meaning that you provide the technique that the patient needs at that time.
Yeah.
I think that's what we need to strive for.
Yeah.
Not just mastering, one particular form.
Yeah. It's interesting too, because, and I've thought a lot about it in the way that I've structured my intake form. I used to have this like really long form, and I don't do that anymore. I have some kind of very basic things, and then I ask a lot of questions as I go through that first treatment with them. And because I feel like that whole first treatment is just a ton of evaluation going on, and sometimes I am, immediately treating in those situations because I have a very strong sense of it. But at the same time, even if I am treating right away, I'm still gathering information. I like, for like what was missed with you, a lot of times, and people will often forget about head injuries or forget about car accidents because it's traumatic. And so they'll kind of lock away certain kinds of things. Or I'll be treating somebody who's got, sort of chronic headaches or something. And I'll have, a question in there about, have you ever had any hard falls to your tailbone? And they won't remember. And then while I'm working, all of a sudden they'll have this memory from when they were 6 years old, falling in their friend's house or something, and it's like those kinds of things always come up. So I try to keep it fairly general. Also, I don't want to influence sometimes what I'm trying to, find in that first session and where I'm going to make that quick decision about the evaluation. I kind of want the body to tell me where to go.
Yeah, one of the ways I've done this so many different ways is one way I really like to do is just evaluate someone before I even have a history.
Yeah.
And see sort of what's happening with that. But getting on to what you said about your intake form, I've done a study with that where I had an intake form that has the patient record all the negative things about their body, like where their pain is and this and that, and focusing all on what's wrong.
Yeah.
And have another intake form, which is, what are your goals?
Yeah.
What are you trying to move towards?
Yeah. That's a really good one.
But it's interesting is that when you fill out the form and then you evaluate them after that, what's interesting is when they get into that state of mind of that negativity, the evaluation is different. It's more restricted. That's why the mind body is so important. That's why I like what you said there, is that I think it's important to always be, where are we going? What's the direction we're going?
Yeah.
Because I really believe that, let's say you have a patient comes in, it can be anywhere. It can be a knee, it can be shoulder, headache. Is that, how does the body heal?
Yeah.
That's the question that we have to ask. It needs blood supply, right? Carrying oxygen, nutrition, needs nerve supply, needs energy supply. But in order for it to get it, you got to get rid of the toxicity. You got to get rid of like the lymph and the venous drainage, the energy flow.
Yeah. And
we have barriers. We have local barriers around that particular area. And then we have total body barriers that affect these pathways of healing.
Yeah.
And that's what I'm always trying to look for in the evaluation is that, is it a local problem where they're complaining of?
Yeah.
Or is there something underlying it? Because A.T. Still, the founding father of osteopathy, he said the rule of the artery is supreme. And what he meant by that is that osteopathy is a physiological model. And the role of manual therapy is basically to create a better environment for healing.
Right. And promote function, just overall function. And that's what I feel like, I know you think this way, but that's where my eye is with people. I'm always kind of thinking that way because we don't have a system of health promotion in this country. We're symptom chasers most of the time in healthcare. Right. And so when I have because I have the ability to sort of help educate and also kind of help promote just whole system function, while I want that knee pain to go away, I also am kind of looking at what's going on with this person as a whole. And I have this opportunity to educate and inform and kind of help get them a little bit more interested in promoting that for themselves.
Yeah, there's an old saying, it's more important to know the patient who has a dysfunction than the dysfunction that has the patient.
Right. So that's great.
Yeah, you have to know, because let's say your patient is in my intake forms, are you married? Are you single? Are you a widower? How old are you? Where are you in your life's journey? Because they come to the clinic with different stresses. They come to it with life, and you have to look at that. Yeah. With everything else. So we're not just manual therapists. We're like life coaches.
Right.
In the same regard.
I find too many times people are so used to going into a clinical situation and having to evaluate their pain, like at what level is this pain, for you today. And to
Mhm.
me, that I think that's just too subjective. I think most people, what they really want is, like to what you were saying earlier, is there's a goal that they have in their mind.
Mhm.
And I think it's our job to engage in that goal so that they know, if they're unable to do that, that's because of what's going on,
Mhm.
physiologically. It's not always, pain related either. I mean, because this is where it gets into some of the mental and emotional parts too.
Mhm. I think what you said earlier is you mentioned function, is that functional evaluation means more to the patient than anything else.
Hmm.
So, you ask them, what are you trying to be able to do? Maybe lift my child, or I'm trying to go to work. I'm trying to, feed myself or get dressed. So you think about, what are all the things you had to do today to get to work? Get out of bed, go up and down stairs, wash yourself, feed yourself, in and out of a car, drive, and think of all the movements you have to do.
Yeah.
Where those are things that are going to help measure change. And they mean more to the patient because they just want to get back to their life, basically.
Yeah.
And that's all we're doing, is helping them.
Yeah. The center I started in Brooklyn was called Everyday Athlete. And we sort of took that as everything we do is athletic on some level, whether
Mhm.
it's getting your kid in and out of the car, or sitting on the ground playing with your grandchildren and having to get up. There's all these different things, and having people just become more aware in their body of how they're using it.
Mhm.
And that leads to so many positive health changes for people. If I almost never got very focused on weight loss, even though I was a trainer as well and did all that stuff. I just found that the more embodied people were, the more they took care of themselves, just in general.
Yeah, and when you talk about that, there's an old book I love. It's called The Yellow Emperor's Book. And it's
Mhm.
about, I think it's over 2,000 years old. I have a copy here somewhere. And in the book, it's a student talking to the master. And he asked the master, if I want a quality life, what do I need? And it was basic things like, you need to exercise. But when they mean by exercise, they mean walking, they mean stretching, they mean breathing, because that cultivates chi.
Yeah.
They mean have a healthy diet. Sleep is so important. That's when your body kind of regenerates. So it's moving your body, it's sleep, it's the food you eat, it's meditation, because that helps to focus the mind. And then don't overindulge. And I look at all that when I work with patients, because if they don't have a good diet, if they're not sleeping, if none of these things are in place, it doesn't matter how good a therapist you are.
Right. Right.
It's not going to make, well, you're a trainer.
Yeah.
If they're not using their body, if they're sitting around all the time,
Yeah.
they've got to do something as well.
Yeah.
So you've got to look. That's why I say I think we're more like life coaches.
Yeah. I agree. And it does, but it's, again, so going back to evaluation, it starts with this evaluation.
Mhm.
We're starting to work with somebody. We've now partnered with them on helping be their coach, and getting as much information as we can from them. So take us through how you developed and what this
Mhm.
system of evaluation is.
So what I shared with you earlier is I was on a journey to heal myself,
Yeah.
and I took hundreds of classes, all different things. And there was classes on muscles and bones and joints and fluids and all sort of energy and things like that. And I had to figure out a way to, and there were so many evaluations, to simplify it. And just like I mentioned before, I had to figure out a way to do it fast. Like you had mentioned, when somebody comes in, how much time you're going to spend with them. So I created this a screening examination. And this screening examination can be done in as little as 5 minutes with practice.
Yeah.
Obviously, when I teach it, it takes a while. And what I'm trying to do with this screening examination is a couple of things. Is if you came to me, we said a shoulder, a knee, doesn't matter, headaches. I want to know within 5 minutes, is this a local problem Like if you came with a knee or shoulder, do we have to focus our attention on that area? Or is there underlying problems?
Yeah.
Like I talked about that pathway of healing. Okay. So if you look at that knee, a knee is a good example. We talked about how does a knee heal. So if you think of the pathway of healing, you think of the blood supply, the drainage, you think of the pathway to and from the heart. Well, it's got to go through areas. It's got to go through all the diaphragms in the body or lines of fascial tension. But also something that people don't think about is arteries, veins, lymphatics, they're vessels. And the anatomy of a vessel is you have endothelial cells, that's on the inner lining. We have smooth muscle, and we have connective tissue. Smooth muscle is under the control of the autonomic nervous system, right? And so we have something called vasomotion. So when you're in fight or flight, okay, you notice that there's vasodilation of your blood vessels to your muscles for fight or flight, but there's vasoconstriction to your blood flow to the organs of digestion. And that's how it works. So if you're in sympathetic overload all the time, it affects all these things. So one of the screening examinations that we do is we evaluate these things quickly. We evaluate the autonomic nervous system, your sympathetic, parasympathetic systems. So we look at the occiput, we look at the spine, we look at the sacrum, because the occiput and the sacrum, that's where the parasympathetic exists.
Yeah.
T1 to L2 is where sympathetic exists. So we evaluate those areas very quickly. Structure affects function. So I can tell very quickly, and also through the tone of your voice, how you're talking and your history, and were you late for the appointment? Just an idea. You people watch, and you get an idea of this person on sympathetic overload. The other thing that I want to understand is that are your transverse diaphragms open? So your pelvic floor, everyone knows about your diaphragm here, your respiratory diaphragm. There's also a diaphragm here, thoracic inlet. We actually have one in our cranium, our tentorium. So why are diaphragms important? Because they're transverse, and all our vital structures run vertical. Right. So our nerves, our arteries, our veins, our lymphatics, our energy flows that way. So if these are restricted,
they're like platforms almost, right? They have to be able to go through each platform as they go up or down.
It's like a highway. If you have a blockage there, it's just a backlog. So if these things are blocked down, I always tell my students this: if I only had one thing to treat, it would be a transverse diaphragm, because you can accomplish so much with that.
Yeah, I agree.
And the third thing I look at is lines of fascial tension and congestion. So think of a body, think of the head, the arms, the torso, and the legs. I evaluate each leg. I feel the weight of it. For congestion, you'll feel like one leg could be heavier than the other. Yeah. I'll evaluate its range of motion through like a leg pump and leg vector. Yeah. And I'm evaluating lines of tension from the legs up into the torso. Yeah. And I do the same evaluation with the arms and the head and neck. And then I check the transverse diaphragms. And then what I do is I check the thorax, because everything has to flow back to the heart. And when you think of venous and lymphatic drainage, they flow from a high to a low pressure. Heart disease is the number one killer. So one thing I check with all my patients is, what's this thoracic cavity like? Yeah. What's this respiratory, thoracic inlet, all this area? And then I check the abdomen. So I check the whole body very quickly in 5 minutes. And then you're like a lawyer, right? You're like a lawyer. You're building a case.
Right.
If you came in with that shoulder problem or knee problem, do I just see tension in that extremity? Yeah. And I could see maybe a little diaphragm there. But if I see multiple things, multiple legs, multiple arms, and I see transverse diaphragms, lines of tension, autonomic nervous system, then you ask yourself a question. If I were to treat that knee or that shoulder, and this pathway of healing wasn't intact, what chance do I have of helping this person?
Right.
I know because I've failed many times with those patients.
I know. I've
you
been
know,
there.
and you learn from your mistakes.
Yeah.
You learn from your mistakes. Why didn't they heal? I was doing everything right. The thing is that it's going back and study a lot of the old literature, is that how does the body heal? We got to make sure that pathway is intact.
Yeah.
So that's one of the things that I evaluate. Within 5 minutes, I know, oh yeah, I can treat locally. Or, you know what? I got to sit back and I got to look at the whole body here. There's something going on.
Yeah.
And this person, from the case history, this person says, you know what? I've been to this therapist, this therapist, this therapist. And I know it because I've treated hundreds of those people. And though they were all good therapists, nothing wrong with that. But I know how they treated. They all treated locally. They
Yeah.
did this local treatment, that local treatment. The body wasn't set up for healing.
So let me ask you this question, because I know this is a big thing for you. For people who are doing manual therapy evaluation, describe how you find that, I think you describe it as end feel, where where you're trying to get a sense of where that congestion is or where that limitation is. What is it that you're looking for?
Well, two things. I'll start off with, let's say I did that screen.
Yeah.
And let's say we found the problem was in that knee or that shoulder. So the question you're asking is, well, how do I take it a step further? So I know that it's in that knee, and there's lots of options. So when I evaluate, I use 4 letters, ARTS. So it's the easiest way to evaluate.
Yeah, I like it.
So, if it's a knee, you place your hands on the knee. Is it level or is one side higher than the other?
Mm-hmm.
Very simple. Structure affects function. That doesn't tell you what's wrong, but it's part of the evaluation. You can evaluate someone's, spine.
You're trying to build a map of sorts, right, of what this structure looks like.
Because do this right now. Your listeners can do it as well. Is that we'll do a couple of these. If everybody turn your head to the right, see how far you go, and then come back to neutral. Tilt your head to the left and keep it there. And now try to turn your head to the right. You don't go as far. Because as soon as if you keep the side bending and now try to rotate, you can't do it. Or if your shoulders are level like this and you raise an arm up and then you bring your shoulder forwards into protraction, you can't lift it as high.
Yeah. Yeah.
Okay. So asymmetry, the more asymmetrical you are, the more it affects functional movement in the body. Yeah. So that's the first thing I look at. Are you asymmetrical? R stands for range of motion. So I get you to actively, move that shoulder, that knee in different movements. And then I passively do it. And when I passively do it, I'm looking for what you called an end feel. I'm looking for, first of all, I get them to actively do it so I can see how far they're doing it, because you never want to hurt anybody. And then I passively lift it and I see, do I get a barrier before that? Where's the first barrier? We call it a feather barrier. And then what's the nature of the barrier? So if it was a hard, abrupt feel, that usually tells me it's a joint. Okay, a joint dysfunction. If it is let's say a soft, boggy in feel, that tells me swelling. If it's kind of a firm and feel, like a little bit of an elasticity, that could be 2 things. It could be muscle, protective muscle spasm, or fascial tension. Okay, so like I said, you're a lawyer, you're piecing this together. So then the T helps you along now. T stands for 3 things. T can stand for tenderness. So I can go and palpate for tenderness. And that's where I learned from Dr. Larry Jones, string counter string. And I use a 0 to 10 scale. 0 is no tenderness, 10 is, they have a jump sign. And that tells me I protect a muscle spasm. T can also stand for tension test, where I can go in there and I can do a mobility. Normally joints have they have some elasticity to them. So there's very subtle movement. But if it's hard and abrupt, I could have a joint problem. T can also stand for tension test or for tissue texture changes. So when I go to feel it, and I always evaluate the unaffected side, then the affected side, you feel that sense of bogginess, and you feel maybe temperature changes, things like that.
Mm-hmm.
And then finally, the S stands for special tests. And special tests can be a lot of things. Can be like a fascial glide. Like if you get your listeners, they can compress into their arm and they can glide it towards their elbow to the wrist.
Right.
And then they can glide it left and right and diagonal and twist it. So, is it stuck there? That's fascia.
Yeah.
We also feel the lymph nodes. Like we have everybody feel their collarbone.
Oh yeah.
Just above it here, we have a whole bunch of lymph nodes. And think of lymph nodes like a sponge filled with water.
Mm-hmm.
And you're feeling, does it feel puffy on one side?
Yeah.
We also have a whole bunch of lymph nodes in the armpit.
Yeah.
Okay. And in the groin. Those would be the key areas.
Yeah.
So everything below your belly button, right? And your legs and your back all drain to your groin.
Mm-hmm.
Everything above your belly button and below your clavicle drain to your armpits. And we have a vertical line, a watershed. So if you have swelling on the left side, goes to the left, swelling on the right goes to the right. Everything here will drain to this area. So that's a good evaluation.
Mm-hmm.
You can, you start to put these pieces together. Do they have some puffiness there? Was that arm heavy? Did they have tissue tension? And so the body is revealing its secrets. Inside special tests, you could do the limb weight test, of one limb heavier than the other. That tells you congestion. But you like cranial sacral therapy, you could feel cranial rhythm. Mm-hmm. If you did Jean-Pierre Barrel's work, he does a general listening, local listening, neurological tests, muscle tests, all of those things. Yeah. So those are all the tools.
Yeah.
So if we go back to the knee, how do I know it's a muscle problem? Well, I know it's a muscle problem and it's a local problem because they didn't meet the criteria for a total body. Everything is all local.
Yeah.
I know there's asymmetry. I know there's decreased range of motion, and it's more of a firm end feel. But the key finding is tenderness. And so, it's so quick once you understand those pieces.
Yeah.
And that's a muscle issue. And then I've treated that thousands of times. So as soon as I, take that muscle, put it in a position of shortening, hold it for 90 seconds, and it's gone, you see the before and after. See, you don't need anybody to tell you did something correctly. You and I both know that in our clinic, that's why it's important to evaluate, because we see the changes right away before and after we treat. We can measure our own success.
Yeah.
We can measure. That's why evaluation is so important. We can measure, well, this is a local problem, this is total body, this was a muscle.
Yeah.
That was a muscle issue.
Yeah.
If the problem, let's say, was a fascial issue, how would you know that? Well, there's asymmetry. There's decreased range of motion. It's got a firm end feel just like the muscle, but there wasn't any significant tenderness. The key finding was a special test, the fascial glide. And so then you know that. And then you were correct, because if you go in there and you do a myofascial release and you feel the heat come off, the pulsation, the vibration, and then you reevaluate, asymmetry is now better.
Yeah.
The range of motion is better. The patient's feeling better. The pain's different.
And that's another important part that I think gets missed is the reevaluating. So way too many times where we learn our technique and we do our technique and we sort of just send them out and say, okay, I hope it feels better.
Yeah.
But
what's wrong with that is that, and I find this with practitioners, is that they could have done an incredible job, but as well as I do, is that the body doesn't heal right away.
Yeah. Is
that it takes a day or two. You've started the process. And so they leave your office and they may be moving better. They might have a little bit of pain, right? So they don't look at you, oh, you fixed me.
Yeah. But
then they go to the yoga class or they go see somebody else or whatever. And all of a sudden, by the next day or two, they're feeling better. And it's not their fault. They're saying they can't put the dots together.
Yeah.
They can't say, oh, what he did helped me. So they looked at the last person that touched. I guess it was that yoga class I went to, or that pizza I had,
Right.
or
Right.
whatever. But that's why it's so important to reevaluate, so that the patient sees, the benefit of your work.
Yeah.
And that's how do you build your practice? I mean, you have a busy practice. I have a busy practice. I don't advertise. My advertisement is my patients.
Right. Yeah.
I have this one lady, she came in, she had like a failed hip surgery. She had lymphedema in this right arm, and she had neck problems, and she was in her, I think, 66, but so depressed the first day. And she was so angry because of the things that have happened to her. And like I said, we're life coaches. I had to really get her to change her frame of mind. But as we started to work with her, and she could see the differences in her body, and like we said earlier, she measured the changes in activities of daily living as well as my measurements. She's already sent me 6 patients because she's seen the changes in her body. I'm gonna have to put her on the payroll now, right? Because she's like filling people up.
Yeah. Well, and back to what you were saying about, people are going to go out, after a session, they're gonna test and try doing different things. But when you were saying that, it reminded me of the other side of that, which is that people come in and they think the last thing that happened to them, or when they had, started having pain, was what caused it. Like, how many people have come into you and said, I think I just slept funny and got a kink in my neck, right?
Mm-hmm.
We know that kink in the neck could be local, but we also, once we evaluate the pelvis, and once we sort of see what's happening from the knees and the ankles and everything, we can see these different asymmetrical patterns kind of working their way up through the system, and we have to treat that system as a whole. And that neck was just an endpoint that was basically, bound to happen at some point.
It's interesting when we talk about that. One of the things that I do that's part of the evaluation is I send them home to take pictures. Is I want to see their, what do they look like in front of their computer or on their phone, okay, their iPad. And I watch them in the waiting room.
Yeah.
When they come in, I see them all hunched over like that. And and it's so important. And the couches are some of the worst places to sit. But there was a study in Canada, it was called the Quebec study. They looked at 250,000 cases of neck and back problems. And what they found out, like 85% were due to ergonomics, poor posture, and lack of movement in that. So that's also an evaluation. We have to look at all those different aspects, ergonomics, and all those things I talked about from the Yellow Emperor's book as well.
Yeah. And I one of my goals with people, if they're at this level of health, is to try to get them moving, and using their bodies in dynamic ways, because that's often also what's missing from why these different areas stay engaged and stay in balance. Because if we're, think about how many more hours a day we're sitting as, say middle-aged people than we were when we were in our, late teens and early 20s. There was just a lot more activity going on in our lives where we actually were, moving. So we've, I always think there's a certain amount of this that's just, we're just adapting to the position that our body has gotten the most used to, which is sitting with tight hip flexors and, legs in whatever position they are and head in whatever position it is, usually looking at a screen or looking down at a tablet or your phone. And so that's the adaptation that our body has made.
And they say that sitting is the new smoking, right?
Right.
It's going to end your life. And it's interesting when you say sitting. I've had patients come in and the pain they had, let's say in their leg, it came on insidiously. There was no mechanism of injury.
Yeah. And
so when you start to evaluate them, you start to look where their complaint is. And there's a pathway from, let's say, that leg has, let's say it's the right leg, it's got to come up to the groin. And that drainage comes up to the, to your diaphragm, goes to the left clavicle and to the heart. So there's a whole pathway there. And so what can happen is every part of your body needs oxygen, nutrition, but it also has to get rid of the waste products. Every cell needs that. And how does the body get rid of toxicity? I mean, we have we have internal toxins from every cell, but we're exposed to the air we breathe, the food, mold, all sorts of things around us. Yeah. So our body has all this. So where does it go? Well, when we look at that, we actually breathe it out. Our lungs is an organ of elimination. But also, as that blood, that lymph and venous return come back to the heart, it goes to the lungs, but then it goes down to the liver. Mm-hmm. And the liver detoxifies it, and then we get rid of it through our bowel movements. It also goes through our kidneys, and it goes throughout our pores, right? So that's how we eliminate toxins. What happens is when we have a buildup, what does the body do with it? Well, it stores it in fat. Number two, it stores it in our bones. Mm. So sometimes when you have this pain, and because you got me thinking about that when people are sitting all the time, because the lymph nodes in your groin, and they have to go through the abdomen and all the way up in here. So you're all hunched over. Yeah. And if you're not moving, you can have a buildup of toxicity, and it gets stored in your joints, it gets stored in your bones. And just by doing a simple thing, opening up the diaphragms, balancing the lymphatic system, all of a sudden these pains start to go, or get them walking, or changing their posture. So I always think of things very simplistically. Think of the basic things, the rule of the artery supreme. Think of your diet, meditation, movement. And the role of manual therapy is to remove these barriers so that the body can function the way it's supposed to function.
Yeah. As you're talking, I'm thinking now. I'm curious. I've taken a lot of Upledger courses, obviously, and I've taken a couple of yours. But I'm curious if you've seen any trends now, because osteopaths at one point were our kind of main primary care people. That has shifted, and it's coming back a little bit in the U.S. It's way bigger in Europe, oddly enough, even though it's
and Canada, and New Zealand,
and Canada and New Zealand, yeah. And so, are there any new trends in terms of who's taking your courses? Like, which health professionals are becoming more interested in this approach?
I really appreciate people like you with these shows, because I think people need to hear different perspectives.
Yeah.
Because what happens is we tend to go down this one lane, and we stay in our lane in a sense, and we become an expert in that area instead of looking at other areas. And I spent my whole life, looking and asking questions. Yeah. And I think one of the best things we can do is we all learn from our patients. I learn from what doesn't work. Yeah. What are their complaints and things like that. The people that I've been treating, or not treating, teaching, are athletic trainers. Since this whole COVID thing, I've been on the Zoom call a lot. And because my background was an athletic trainer to begin with, I'm getting a lot of calls. I'm actually in a lot of their conventions next year, and I see a lot of them popping up. I actually had the head trainer for the Edmonton Oilers, the hockey team. He attended my class, and he's using it with all Edmonton's players, and he loves it. My total body balancing class, looking at the whole body. So, and I really want trainers to take the class. That's where I started. And I think of where I started as an athlete and the pain that I went through, because I never did play professional football. That I was a kid, and that's what I wanted to do my whole life. And so I have a soft spot for trainers and in the class, and I think it's important for them. And I've had these talks with them. They follow that Cartesian model. Person comes with a knee problem, they get in the ice cold whirlpool tanks, they're ultrasounding, e-stim, and everything is very local. I had one guy come to see me. He's a baseball player for the Florida Gators college team, and he was treated all summer. And guess what they did? It was a shoulder problem. They did rotator cuff exercises. They did e-stim. They did ultrasound. That's all they did. And he's coming to me, and this guy's in tears, this young man, because this is his future, right? Yeah. So he heard about me from someone else. He came in, and I did my screen that I told you about. Well, it's not coming from his shoulders. It's coming from his legs. So I lie him down, and I'm showing this, and I'm working on his legs. And his dad goes, when are you going to work on his shoulder? And finally, his son had to say, will you just shut up, Dad? Just let him do what he's going to do. And I purposely did not touch his shoulder. I worked everything else but. And when we were finished, full range of motion, no pain.
Yeah. What did you
And
find?
so, well, it was all lines of tension from the legs, old injuries all built up. And his pelvis wouldn't open up. Think of your lat dorsi comes from your sacrum and your lumbar spine and comes up to the bicipital groove.
Yeah.
The shoulder, I lecture on the shoulder a lot because when a patient comes in with a shoulder problem, I always ask my students, well, where would you evaluate? They go, the shoulder, right? But think of your upper fibers of trapezius going to the occiput, so craniosacral, or sternocleidomastoid, the temporal bones, or subclavian muscle, or your biceps, going into your elbow, triceps, or pectoralis major and minor, your rib cage, rhomboids, thoracic, lat dorsi, sacrum, and then all the different chains. So the shoulder is a nice area to look at. So I really love working with trainers. I'm getting more of them. I get a lot of massage therapists, and I try to do a lot of lectures at their meetings. And they're starting to evaluate. I think as of this year, they're allowed to evaluate. My sister's a massage therapist from Canada, and their program is a 3-year program. So they actually learn a lot of the evaluation. And I'm so grateful that Florida is now allowing, their therapists to do that. I also get, of course, physical therapists. I teach a lot of physical therapy conventions. I've had the odd chiropractor, and I'm getting more osteopaths attending my class. I want to reach out also to acupuncturists because I'm an acupuncturist, because I like to do the manual therapy first and release all these barriers before I do my needles.
Yeah.
And I think the energy is just going to flow much better. So that's probably the people that I mainly focus on. With my energy classes, I tend to teach that same group, but I also teach it to lay people. And that's something that and it's something that I'm really excited about. And people, when they hear the word energy, they kind of look at you, in a funny way. And I did the same thing.
Yeah.
But when you look at the body, your body is made up of like 20, or was it 200 trillion, or I know 100 trillion cells. That's it, 100 trillion cells. Each cell is made up of 100 trillion atoms. And if you look at one atom, it has protons and neutrons in the center, and it's got electrons around it. If you were to give the protons and neutrons a size like a peanut and place it in the middle of a football field, that would be the electron field.
Yeah.
So think of your body, 100 trillion cells. Each cell is 100 trillion atoms. Each atom is like 99.99999% empty space.
Right.
That's what your body is made of.
Space and electricity.
We're made up of consciousness. We're made up of thoughts. And people always say, well, why are you so solid? Well, because these atoms have electrons and they're negative charge. And the atom beside it's negative. So they repel each other. So that's how we can create a solid, fixture. That's why I can sit on this chair and not fall through it, because it has a negative force as well.
Yeah.
So that's sort of how it's set up. But the body, I've been working on this for the last 30 years, graduated in 88. And my mentor, John Warnham, who was my teacher, he was 99 years old. And I hope to be doing this stuff in my 90s.
Yeah.
There's just so much to learn.
Absolutely.
I'm like you, I'm reading books every week. I'm taking classes. I want to get better. I want to learn from other people, because you can only see one perspective from your side. You want to try to get ideas, see things from other people's point of view.
Well, and it kind of begs the question of what we're working on when we're trying to improve health or improve function is, there's this experiencer that we're working with, right? And I feel like a lot of what we're trying to do is improve that experience of that person. And this is where it gets very soulful and in a lot of ways is we're trying to elevate, and also I think there's a big part of this that, in this material world, we're actually trying to have connection. We're trying to, sort of be more part of one, together. But when we're experiencing pain, or when we're feeling dysfunction, or things just aren't working very well, you can almost kind of see it in a person when they come in. It's like they're almost kind of like lost, deep in there. They can't quite be their full vibrant self. And I feel like that's a big part of what we're working on most of the time.
A patient, I do a lot of treatments over the computer with the energy work, telehealth. And a person I worked on yesterday, right away, she just got on there, didn't say a word. I said, okay, what's going on? Yeah. I've never seen you like this before. And you could see everything was just all, sunken in.
Yeah.
And I think that's how, it's about using all your senses. We have the sense of sight, but we have a subtle sense of sight, imagination.
Yeah.
We can hear, but we also have a sense of, things will just pop into our mind.
Yeah.
We have a sense of touch, but from a distance, we can actually feel things through that subtle sense. So it's about using all our senses, both physical senses, but subtle senses in our evaluation. And, it's about using our whole brain. We can access, millions of bits of information. And I always allow my right brain to kind of wander. Where do I get drawn to? But then my left brain comes in with the evaluation to hone it in and say, okay, was this what I was finding? Is this what's happening? I wanted to share one lady who came to see me. I always talk about her in my classes because it's so striking, is she had 10 years of headaches and neck problems. And everybody treated her for 10 years, headaches and neck. They did massages here, acupuncture, physical therapy. She went to chiropractic. When we did that total body screening examination on her, it was her left leg. It was her diaphragms. It was other areas. And then she tells me that when I look down, that her left foot is bigger than the right. She had had 4 surgeries. It still has a wraparound. It's still stuff oozing out. So picture her, she's lying on her back and I'm standing at her head and her legs are straight and I'm trying to move her head in different positions and I couldn't. But as soon as I got her to bend that left knee, I could pick her head up and I could move her head anywhere I wanted.
Yeah.
So there was a line of fascial tension from that left leg coming all the way into that area. So just like that baseball player, as soon as I start to release those lines of tension, in that leg, all of a sudden that neck started to free up. Yeah. I still see her to this day. She comes in for tune-ups. But that's why I'm so passionate about this, is because, we need to look at the whole body. We need to look at everything as it comes in. And, we try to streamline it. I know everybody's busy. I know, some people see 4 patients an hour. Some people see 2, some people have the luxury of an hour. But that's why, I streamlined that to 5 minutes. So even if you only had 15 minutes, 5 minutes evaluation, then boom, go to that area and start treating. But we really have to get that word out because, I suffered. And, that woman for 10 years suffered. That baseball player could have suffered. And there's many, many more like that that are walking around that don't have to suffer.
Yeah.
And it's not that the therapist isn't a good therapist. And it's not their fault. I think it's the school's fault in a sense. It's our country in a sense, because workers' compensation, for example, tells you just treat the knee and you have 6 visits. Yeah. We get honed in, and probably when you went to school, you have a neck problem, massage this area, unless you're doing a relaxation for the whole body. We're told, a doctor say, work on that area. Insurance company, even the patient says, work here. But we have to really sit back and we have to look at the body with our subtle senses and our physical senses, look at the whole picture, look at the history, look at everything before we begin.
Yeah. And I think a lot of my understanding of this came because I also got into this field from a physical challenge. I was having chronic back problems in my 20s, and probably had started even earlier. I remember having problems when I was playing basketball in high school. So, but I have a sort of a deformity with the way my foot and tarsals grew. So my ankle's a little funny, and I sprained that ankle a number of times. And so, but no one had really evaluated me in this kind of way. And I was, I was young enough that when I went to go see the doctor or see chiropractors, they were sort of like, oh, you're a young guy, you'll be all right. But I felt miserable. And as I learned, a lot of my problems were really coming from my legs and from my ankle and all this different twisting that was going on. And to what you talk about a lot in your course is that we're, the body is this dynamic unit of function where we're have a spiritual or soulful side to it. There's a lot emotional and mental and all the different physical parts of it. And if we don't, and I learned a lot from going through my process, because once I got some of the physical things worked out, I still had a lot of problems with anxiety and dealing with stress and that kind of stuff that I still had to continue to work at. So being able to be addressed that way, and I always feel that way. Sometimes I feel like I do very minimal things when I'm first seeing somebody. Especially a lot of times I'll start out with craniosacral work, because if I'm using that low of force and they have something really profound happen, that tells me something too. That gives me a lot of information, and it also helps them understand something else that you teach a lot, is that the body is self-healing, that really we have the ability to heal within ourselves. And people love to kind of like throw this out to me as, me being the healer. I'm there as part of an assistant for your process. And I have the tool set that I have, and I got a lot of tricks in my bag, but I'm not a healer. I'm not just going to like wave my magic wand and you're going to get better. You have to engage at a certain level with me with all of that as well.
And those are the questions we ask. Where do we treat? What do we treat? And the third question we were just getting to is why. Why are we treating that area? What's it going to do? And it all goes back to that physiological model. And the next question, to ask is, well, how long do we treat for? That's why I don't like to give a time frame. I don't say, oh, it's an hour treatment, so they're expecting an hour treatment. No, it's a session. I'm going to take you to a safe place, because AT still would say you only have to do enough, and nature will kindly do the rest. Is that sometimes we tend to overtreat. We tend to and when I'm with my students, I try to get them. Obviously we overtreat when we're teaching classes because we're working technique after technique. But I get the therapist to pay attention to, as someone's working with you, I don't like to say, do it 3 times, 4 times. I go, wait, do it till you feel a shift. And you'll feel this sense of lightness that takes place, that things are flowing. And if you continue to work with it, all of a sudden a heaviness will start to appear. It's like the body is going a different way. And you as a craniosacral practitioner, that when you work on an area, is that you have signs. All of a sudden, person just took a breath in. Oh, the cranial rhythm's starting to come in. Things are starting to open up. So what do we do? Do we take our hands away? Do we go down to another level?
Yeah.
Where do we need to go with this?
Yeah.
And I think these are questions, that we really have to pay attention to. And it's different. My father, who was 85 years old, he's passed away since then, but he had some issues. He was in the hospital. We had congestive heart failure. So we talk about a dose. How much can you treat someone? For him, his body could only tolerate 5-10 minutes.
Yeah.
But if I'm working with an elite athlete, I could work with you 2 hours.
Right.
Your vital force.
They're conditioned for it. Right.
Yeah. You can handle that. Yeah. So I think, as practitioners and teachers, not only, do we have to focus on, where to treat, what to treat, and why, and also, focusing on these different techniques, we also have to focus on dosing. We have to focus on how long.
Yeah. Even with manual therapy, I mean, think about it in relation to like how you'd use a pharmaceutical. There are certain people that we know we have to give the smallest dosage to. When they come in, you can tell like less is more. And so, and then it's similar to the dosing. You titrate up just slowly as you're working with them over time. Sometimes by the end of the session, even you can kind of work in a little bit more, there is a feel to that. But I think the more you see the patterns of some of these people, even just, what you get from them as they come in, like you're saying, like, what is the quality of their voice like? What's their posture like? Just from the beginning, you get a pretty good sense of where you're going to start with that level too.
And then what's beautiful is you see the change.
Yeah.
Patients will say, well, I'm doing more at home. I'm able to, lift all these boxes, go up and down the stairs. And you see, that capacity, that endurance that they're able to go through.
That's my measure.
Then, the life force, that's their life force.
Yeah. That goes back to the goals, right? I'm always I'm kind of retesting goals with people. They may come in and, at first say, well, I just want to be able to get up and down off the floor because that's really difficult. But then all of a sudden they pass through that and we have to create a new goal. Well, you can do that. Now you want to do more walking. So, let's check in with that as our measure rather than just pain. I mean, especially as we age, we're going to have discomfort from time to time, and one of the things why I was sort of interested in asking you the question about who's coming to these courses is I feel like there's so much good information here that we could learn from in a lot of different health fields. And, some of the limitations are happening from insurance and that kind of stuff. But I still think there are a lot of different ways in which we can influence, coach, our patients and clients to really kind of engage a little bit more in this process and realize the possibilities that they're not their condition, that can actually change. And that's hard to change that belief system for somebody who's, say had, headaches for 10 years, but I've seen it, and I've also experienced it with my own body, just as you have. And so I think that's something that's really important to kind of, I think, push out there, that you have a little bit more control over that, as, over your own health and how you engage, and even just creating a team of the right kind of practitioners around you to support your process.
We talk about mind, body, and spirit. The spirit is the highest level. There was a book called Man's Search for Meaning, Viktor Frankl. It was in Nazi Germany. And he would watch the people that survived and those that didn't survive. And he saw that those that did survive had a meaning to get up every day, a meaning to tell their story. And what I find with my patients is, a lot of patients will give you lip service. Oh yeah, I'll do this, I'll do that. But I really have to look at their spirit. Do they want to get better? Because some people they just don't want to get out of bed. They're depressed, they're this or that. And you have to find that spirit. Yeah. The spirit, their vitality, for me, is the most important thing. Yeah. So that's what I look at first. I look at their mindset. And if I can get their mindset, like that woman I told you about with the failed surgery with her hip, the lymphedema, all that, it was mindset. It was her spirit. She's such a different person now. She still has the lymphedema and all, but she's doing more now. She's less pain. She's living a lot more. So spirit for me is the most important. And then getting the proper mindset behind that. What are you going to do each day? It's about changing your habits, isn't it? Yeah. Because, if you were my patient, it's a 60-40 split. You're the 60%, I'm the 40. Yeah. I just create a better environment for healing. But like you said earlier, your body has to heal. I'm not the healer. Yeah. You have to do it yourself. Yeah.
So much fun talking to you, man. This is such great. This is the stuff I love. And I know this is very sort of overviewy in some ways, but I also feel like this should set a tone for the way that we think about our own health and the way that we think about care. So but I'd love to have you back on again to get into maybe more specifics of some of these modalities too, because there's a lot, and you just have so many different things that you have so much experience with. I'd love to get more from you.
I would love that. This was pretty easy. It was fun just having a chat.
All right. All right, Kerry. Well, thanks so much. I really appreciate your time, man.
All right. Thank you very much.